Hello there. Welcome to my show, COVID-19 Update by Heerak, for October 15, 2020. You're hearing music from Brazil, and as you know, they speak Portuguese there. Brazil has broken 150,000 COVID-19 deaths, and it's in South America. And there are a lot of Brazilians in America as well. Um, so a lot of Brazilians are worried about the 6 months of flu season. And millions may die by June 2021, including little babies. Today is Infant and Pregnancy Loss Remembrance Day. Today's October 15th. So there are mothers and fathers who lose their babies as a baby. So that some babies die from sudden infant death syndrome. They just stop breathing for no reason. Or there's probably a reason, but there's no disease that's causing them to stop breathing. They just stop breathing. Um, yeah, and so there are people who die like that every year, and there are babies who die when the pregnancy fails, um, and miscarriages. That happens all over the world and in America, and it hurts the parents a lot. Obviously, if the mother is over 30 years old, she has more chance for miscarriages and failed pregnancies than if she's under 30, because your eggs age with you. So all the eggs of a woman is in a female baby when she's born, and the eggs age with the woman. So when a woman is 30 years old, the eggs are 30 years old. Um, Koreans actually count uh, from one, not from zero. So when a baby is born, in Korea, you're 1 year old when you're born. So they count pregnancy period as like 1 year. Obviously, they're rounding up. Um, and so, obviously, eggs are older than the age from when you're born. Um, Eggs in a baby are already there when the baby's born. So, yeah, so it's kind of an interesting cultural fact. Those of you who are Koreans from Korea know what I mean. Korean Americans who are born in America might not know this. Uh, some may know, some may not. There are cultural practices that are dominant in the old country like Korea that may not be totally in the awareness zone in the new country in America. Maybe, Virginia delegate Mark Kim from Vienna knows about this. When you're born in Korea, you're 1 year old. So Korean age is always 1 year more than like American age. Um, yeah, interesting fact. And yeah, I mean, right now, Brazil is number one for COVID-19 deaths. And you're listening to music from Brazil. Pretty nice, isn't it? Brazil is an interesting culture. They have the Carnival. It's a very social culture. In fact, all of Latin America, South America, Central America, people are very social. They like to talk to each other. They like to get together for dinner. Sometimes get together for dinners in more than just their family, like with their neighbors or their cousins. Very social culture. It's very different from like Korean culture. You know, uh, Traditionally, Koreans don't talk to each other when they eat. Koreans used to. This is a traditional Korean culture from decades ago. When people eat, they don't talk; they just eat. That's just part of Korean culture. Now, obviously, Koreans talk, but in decades ago, you're supposed to eat in silence. And you talk during dinner. Your parents would say, "Shut up," don't talk when you're eating. I guess it's kind of seen as a moment of silence from all the brouhaha in the world. Um, Korean culture, it's part of the Confucian culture, part of the Buddhist culture. They value meditation, moments of silence. So when people are eating, it is seen as a time to just kind of relax, contemplate the food, enjoy the food, and contemplate life individually. And obviously, people talk outside of the meal, you know. But Western culture is very fast paced. So you work from 8 to 5, and you eat dinner, and that's when you catch up on things, right? After dinner, you may be getting ready for sleep or catching up on other things. So people just talk during dinner. So dinner is seen as time when you kind of catch up on things. And so sometimes, social practices determine the way people act, right? And because if you see movies like Pride and Prejudice, people used to walk around and talk, and so there were moments of conversations, person-to-person conversations outside of dinner times. You have the tea time before the dinner time, and people talk during tea time. Um, and so the cultures have significantly changed since the industrial era. And industrialism in America was much earlier than industrialism in Asia. But obviously, as Asia became industrialized, dinner became time to catch up as well. Industrialism has good things and bad things. Interestingly enough, COVID-19 is shutting a lot of businesses down. So we're kind of shifting our culture from this radically capitalist, industrialist, manufacturing, production oriented culture to kind of, slowing down culture, which is dictated by COVID-19. In Latin America, South America, and Central America, people like to talk, eat over meals. They like to talk all the time. It's a very social culture. And some people say that's a beautiful thing about Latin American culture, Hispanic culture. But during the global pandemic, that may not necessarily be good that you're always socializing with people in person. So COVID-19 may require a cultural shift among Latinos in America, but also Hispanic people in South America and Central America to stop personally socializing people to people, but maybe do it online. The problem with South America and Central America is that internet is not ubiquitous. It's not everywhere like in America. In the sense, like in America, you could go 100% online. You don't have to meet anybody. You could socialize with people 100% online. And there are track phones that are internet phones. So even the poorest people in America can socialize online. We have very good social services in America, but it's not like that in other parts of the world, what we call the third world, developing economies. Uh, like in India, there are villages that don't even have lighting, proper lighting. At nighttime, it's just completely goes dark. And even in cities, electricity is not dependable. Sometimes you have outages often. That was the case when I was teaching in India. Whenever I teach in India, we have like electrical outages once in a while. Um, so electricity isn't even dependable in a city like Bangalore, which is considered the internet hub of India. So you can imagine how things are in the poorer areas of India. And that may be the reason why there are so many deaths in India. It's over 100,000. So in developing world, there's a serious problem with communication, right? If you don't talk to person to person, you're not going to be able to talk to anyone because not everybody has phones. Certainly not everybody has cell phones. There isn't the infrastructure there or the money. A lot of people are poor. In India, some people make $50 a month, and yes, internet services are cheaper in India. Cell phones are cheaper. Cell phone services are cheaper, but still, if you're only making $50, you can't, um, make cell phone available to all of your children, right? So there's limited ways to communicate in third world countries that the problem that we don't have in America. We can go 100% online. You can survive without no problem. And as you know, I recommend that 100% of the colleges go online because we have the technology to do it. Why don't we use the technology to save lives? I'm an independent candidate for U.S. Congress in Virginia's 8th District. And I'm also recommending that all the business transition to online work so people can work remotely from home. We have the technology to do transition. Companies just, they just have to take the step to transition to online work from at home work. And some companies have done it. We have the technology. Why not use to save lives? But not everywhere in the world do they have that luxury to survive COVID-19 by going 100% online because they don't have the technology or they don't have the access to technology to do that. Um, and that's the case with parts of Latin America as well. So Brazil has 5,140,863 cases, a 3% death rate, which is same as America's. They have 151,747 deaths so far. And it's very hot in Brazil, so he's not going to kill it off. And we know the cold doesn't kill it off. So COVID-19 is going to be killing a lot of people in Brazil from now to June. They may have millions of deaths in Brazil by June 2021, unfortunately. And Argentina is number 2, but it's going up there. You see, they're almost a million now. And Argentina can have COVID-19 explode and have like 1,000 deaths per day as well, and eventually catch up with Brazil. So Argentina could technically have 1 million or more deaths by June 2021, which is unfortunate because there were so few cases and deaths in Argentina like 3 months ago. But now it's in a crisis mode. 931,967 cases, 24,921 deaths, 3% death rate. And if you're in Argentina, and I know a lot of people in Brazil and Argentina watch this show, you're in trouble. Your country's headed to death. And if you're in Argentinian in America, you can expect to see your relatives get COVID and some of them die. It's going to be horrific there. Colombia is number 3 with 930,159 cases, 3% death rate, 28,306 deaths. So as you can see, Latin America, I'm calling the continent of COVID-19 death. You see how so many countries have 5 digit or more COVID-19 deaths, and it's continuing. It's going to get worse and worse. Peru is heading toward 1 million cases as well. 856,951 cases, 4% death rate. So it's a little bit higher, which is showing up in larger deaths than in Argentina or Colombia. 33,512 deaths. And obviously during the flu season, more people are going to die than during summer. So the percentage of people who die will go up from 3% to like 4%, 10%, 20%. So Latin America is the continent of death. Partly because of the socialization process. People like to get together and socialize. And obviously that's how COVID-19 spreads. And partly because they have no choice in certain areas because they don't have the technology to go 100% online to socialize. But, convergence of several factors are causing this identity of Latin America as the continent of death. Mexico has 829,396 cases, so they're headed to 1 million cases as well, and they're going to easily surpass it. But their death rate is 10% even during summer. It's probably because of all the marijuana and drugs. Like Mexico is known as like the drug hub of Latin America, and evidence-based research has indicated that marijuana users have higher chance of dying from COVID. Since there are a lot of marijuana and other types of drugs in Mexico that comes into America, that may explain why the death rate is so high, right? Because they're just like more users of narcotics or cocaine or marijuana. So the death rate is 10% and 84,898 people have died. So it's unfortunate if you're Mexican American, you're going to have relatives who probably will get COVID and many will die. I mean, they'll easily have many deaths, maybe over a million deaths by June 2020. And if you're Mexican American, you should worry as well because you have the same DNA makeup as Mexico. You have similar cultural practices as the Mexico. Um, it's a worrisome thing. I have photos of me from Jesus College, Cambridge. I used to love Halloween parties every year. I would dress up for our college Halloween party. And this one year I dressed up as a cowboy or a sheriff. Um, and you see like how nicely all the Jesus College, Cambridge students dressed up. Not all of them dressed up. Like the woman next to me was wearing red, but I guess she was imitating Lady in Red and Julia Roberts movie. Who knows, you know? Um, yeah, not everybody gets into the spirit of things as much, but but she's pretty enough. I guess she could get away with it. But generally, when you go to a Halloween party, you wanna dress up as something, right? Um, yeah. But Halloween's coming in October 31st, and it's going to be a super spreader event for Arlington County, Alexandria, Fairfax County, Falls Church. This is Virginia 8th District. As you know, I'm running for U.S. Congress in Virginia's 8th District. And so I'm calling on Arlington County Democratic leaders, basically they're all Democrats, to have a curfew and to ban Halloween parties and trick-or-treating. Obviously, I love Halloween. Look at the way I dress up for Halloween parties. I love going to Halloween parties. But, I mean, life is important. I don't want Arlington people to die from COVID-19. That's why we need to do the right thing and the brave thing and shut down Arlington County. So we don't have super spreader event. It's going to spread to people who don't even dress up and celebrate Halloween, it's going to kill a lot of people. I mean, I'm predicting that over tens of thousands of people will die in Arlington County alone, where I live. And Virginia Hospital Center is going to be flooded with COVID patients like in the next few months. And it's going to run out of space. I mean, it's like 100% guaranteed. And obviously nearby hospitals as well. Unova Fairfax Hospital, Unova Alexandria Hospital, Washington Hospital Center, Metzler Georgetown Hospital, George Washington Hospital, Children's National Hospital, Sibley Hospital. They're all going to run out of hospital beds. That's coming in a few months, maybe even sooner than a few months, maybe in a few weeks. Because it's a spike upward. It goes like this, and before you know it, it just hits a spike. And then, you're being flooded with COVID-19 patients and they die everywhere. So that's coming to Arlington, Alexandria, Falls Church, and Fairfax County. And Halloween will help to speed that up. So whereas if you ban Halloween in Arlington, Alexandria, Falls Church, and Fairfax County, we may not have, hospital beds filled until like, maybe, end of November, beginning of December. But if you have Halloween, hospital beds may hit maximum capacity, by November, like mid-November, or like end of November. It'll be like there'll be no space. People will be like dying in like hundreds of people will be dying in the Virginia's 8th District area, Arlington, Alexandria, Falls Church, and Fairfax County. That's possible. Obviously we're trying to avoid that. And that's why I'm encouraging all the Democrats. This is a completely Democratic area. Like Alexandria City Council is 100% Democrat. Think about human life. I know you support killing little babies through abortion, but it's wrong for you to like jeopardize lives of Alexandria residents by letting them have Halloween parties and trick-or-treating. Because it's going to be a super spreader day or event because there are Halloween parties happening many different days, not just on Halloween night. I love Halloween parties. I go to every single one whenever I can. But, you don't want people to die in large numbers in the city of Alexandria. Come by, you should also so join me calling for a shutdown of Alexandria, your city, during COVID-19. I mean, if you care about your constituents, you should join me, Heerak and Kim. I know I'm running against you, but right is right, right? I'm just trying to save the lives of Virginia's 8th District. It's not about the political party, right? It's about all the people. So Don Beyer, I hope you join me in calling for shutdown of Alexandria, Arlington, Falls Church, and Fairfax County for Halloween. Like curfews, shutdowns, banning Halloween parties and of all kinds, and trick-or-treating. Yeah, I mean, it's not a popular thing to do, but you want to save lives, right? I mean, once the super spreader happens on Halloween night, you can't stop it. You can't stop it. It's going to continue, and death are going to continue. You can't stop the death. There's no vaccine. There is no cure. There is absolutely no cure for COVID 19. Once you get it in flu season, you could die from it. Yeah, I mean, we don't want people to die, right? I'm predicting like minimum 12 nurses, registered nurses in every hospital will die by Christmas 2020. Because we have two main events that's going to spike up COVID 19. That's Halloween that's coming, end of October, Thanksgiving that's coming, end of November. These are two events that's going to just crazily spread COVID 19 and increase COVID 19 death in Virginia's 8th district. Because even if you make it illegal, there are going to be secret parties, there are going to be secret gatherings, right? So even if you illegalize, you're not going to completely stop the spike. You're just going to reduce the spike. You may go like this rather than like this, you know. Um, so even if you reduce the death, you may still have thousands of death, but you may prevent tens of thousands of death. You see what I'm saying? This is why we need to shut down Halloween, which is the the major holiday that's coming in a few weeks. But the Democrats in Northern Virginia, they don't care about your life. I mean, why would they support killing little babies if they care about your life, right? You know, life is expandable, you know? If it's convenient for you, abort your baby. Um, if you want to have more fun, risk killing your baby, you know? So, I mean, you can't have these Democrats caring about your life, right? Life is cheap to these Democrats. So I understand why Alexandria Democrats, Arlington Democrats, Falls Church Democrats, and Fairfax County Democrats don't want to have a curfew during Halloween season, that they don't want to ban trick or treating, they don't want to illegalize, um, Halloween parties because they don't really care about your life. You know, I care about your life, right? That's why I worked 3 months to shut down every public school in Virginia's 8th district, Arlington, Alexandria, Falls Church, and Fairfax County, because your life is important to me. Having fun is not the most important, right? Saving your life, your children's life, that's the most important. Because, I'm all about life. I march for your life. I've been active in pro-life movements at University of Pennsylvania when I did my bachelor's program. I was very active in pro-life movement at Georgetown University, Georgetown Pro-Life. Um, I care about your life. Care about little babies' lives. Um, yeah, so we need to shut down Virginia's 8th District for Halloween if we want to save lives. You can't avoid it. There are 749 people who died in the last 24 hours in America alone, United States alone. And confirmed cases are 7,927,975, and deaths are at 217,155. As I became a nurse. I'm a registered nurse in Virginia, and I have a multi-state license, so I can practice as a registered nurse in North Carolina, South Carolina, Texas, Florida, West Virginia, Maryland, some 30 states. And I have a separate registered nurse license in District of Columbia because they don't participate in multi-state license. And I'm a nationally certified clinical nurse leader. So, I care about public health. That's one of the things that we care about as clinical nurse leaders. And I don't believe in the liberal media that keeps saying that it's okay to go to a Halloween party with a mask. It's not that simple. As you can see from the little red riding hood photo next to my video, COVID-19 spreads by airborne transmission, which means you can get COVID even with a mask on. That's what airborne transmission means. So it's not safe to go to Halloween parties with a mask in closed spaces. And it's not safe for your children to go trick-or-treating with a mask because they could get COVID because COVID-19 is an airborne transmission. Um, so it's, you know, um, you need to keep up with the science, and that's where I come in. Clinical nurse leaders, CNLs, we're interested with researching evidence-based research in nursing and making sure that everybody is aware of the latest information in nursing and science. So I provide this show as a public service, public health service to Virginia's 8th District, but throughout the world, um, for ways to save your life. And there are 25 of us who graduated from Clinical Nurse Leader program in August 2020. And I'm predicting 5 of us will die before Christmas. People with asthma or diabetes or who are fat, obese, who have other pre-existing conditions. Some have shared that, some have not shared it. There's a high chance that a lot of people will die. And I'm saying minimum 20% of my graduating class in August 2020 will die. So I'm going to do a cheer for my clinical nurse leaders. CNL 2020 at Georgetown, yay! We graduated in August. We may die from COVID, but we can write on the tombstone, CNL 2020, Georgetown University, yay! So not everybody has taken a CNL exam, and not everybody has taken a registered nurse exam yet, NCLEX RN. And if you don't pass, you can't write RN after your name. I passed. I put RN after my name. I passed my CNL exam, so I put CNL after my name. Um, we still haven't gotten our pins yet. Georgetown University pin. We were all pinned. 25 of CNL students, 26 PSN students were all pins in June 2020 in a virtual pinning ceremony, and the pin looked great on the virtual. They put it up really close to the screen. And so I'm like waiting for my pin, and Amanda Patterson, our CNL clinical nurse leader administrator, said she'll mail it out on the end of September. And so I was asking my fellow CNL members in our group chat, where's our pin? And Billy, the naval officer who served in the Navy for like 20 years after he graduated from U.S. Naval Academy and he's an officer. And he served 1 year in an emergency secret mission in Somalia between his first year and second year of CNL program. So he's CNL 2020. He used to be CNL 2019. He said, if Amanda cannot get to the nursing school building, then, she can't mail it out. Because, Georgetown University is completely shut down. So 100% of the classes are online for undergraduates and graduate students. So nursing building is shut down completely. So I worked 3 months to shut down Georgetown. They were going to originally open with all the freshmen and some seniors. And I said no. We don't want to have massive death in the flu season in 2020. We don't want to super spread COVID-19. So shut the campus down. Right? I advocated for Georgetown students for 3 months to shut it down. Finally, Georgetown administrator listened. Obviously, I know all of them. Some well, some not, because I was the vice president of Georgetown University Graduate Student Government from May 2019 to May 2020. Most graduate students graduate in May, so the term goes from May to May. So I know President Duoya, he's a nice guy. I know the provost. I used to go to his monthly meetings to improve Georgetown University for students, undergraduates and graduate students. So I was in the provost monthly advisory team. And so, I know all of them. I know the vice president of Office of Missions and Ministry. Georgetown is a Catholic university, as you know, Catholic University. I know the vice president, Olson, of vice president of student life, takes care of all the student life issues. I know the deans of colleges, and I formed the graduate senate made up of all the representatives from every graduate program, master's, certificate, and doctorate programs throughout Georgetown's nursing school, School of Health Studies, School of Foreign Policy, School of Public Service, Public Policy, Business School, Medical School, Graduate School, and so I know all the chairmen and directors of programs. So, I'm glad that they, went in my direction. They had research meetings and they made the right decision to close the university down. But unfortunately, that means people are not going to the campus, right? And evening staff, which is good because we're not gonna have that many staff die because of that. But since Amanda Patterson is our CNL administrator, she's working remotely as well, right, from her home. And so she, I mean, she has to get to the building to get our pins to mail it out to us. And so Billy's like on a group chat saying maybe she wasn't able to get into the building. So I don't know. I hope I don't have to wait until like next June for our pins, you know what I'm saying? Because we have 6 months of COVID-19 death coming all over America. Um, yeah, I'm predicting that 6 million, 3 million to like 6 million or more will die in America in the next 6 months from flu. Well, COVID-19, but there will be flu death as well. That's from other viruses, winter viruses. Um, yeah, but Billy's taking his NCLEX RN exam today. So good luck, Billy. Yeah, give me a 5 on the pass. Give me a 5. Yeah, I mean, he passed his CNL exam. He was in my group. Uh, our capstone group project. And we worked on, Billy was actually our leader, the capstone group project. And and he's a great leader. He's born leader. I mean, he was in the Naval Academy. Everybody who goes to Naval Academy as a cadet is a leader, right? By definition, because they lead soldiers, right? They're commanders. Yeah, so he has incredible leadership skills. He's from Texas. Um, but yeah, so our group, our capstone project group, our project was working with MedStar Georgetown University Hospital, chief nursing officer, and there's another executive, chief, I guess, nursing research officer or something like that, uh, to improve, provide proposals for improving MedStar Georgetown University Hospital. So, we got like 96% on our group project. So, we did a really good job proposing um, improvements to MedStar Georgetown University Hospital. Our suggestions included having hazard pay for registered nurse RN residency program participants to motivate them and encourage them because they're risking death. I mean, everybody who's in an RN residency program during COVID-19 is risking death, and some will die. As I said, 5 of my CNL 25 cohort graduates will die by Christmas 2020. I'm predicting. Unfortunately, I hope none of you die. I love you guys. I don't want you guys to die, but I'm predicting that 5 will die because they're in RN residency programs. At Innova Fairfax. At at Children's National Hospital, MedStar Washington Hospital, not at MedStar Georgetown because their RN residency starts like in July and January, and we graduate in August. So there's no CNL 2020 at MedStar Georgetown Hospital. Um, but some may go in January, like those who Amanda Patterson emailed out to our clinical nurse leader group that Innova Fairfax is recruiting August graduates. And so, I know some are waiting to apply after they pass RN exams. Because if you get hired before you take the RN, NCLEX RN exam, and if you fail, it's immediate termination from job. And obviously, if you're working full time, do the do. Do you remember the commercial? Do the do Mountain Dew commercials? Yeah. Anyway, yeah. So, like in my RN residency program at Virginia Hospital Center, we have students who are going to take their NCLEX RN, but if they fail, they're immediately terminated. They're immediately fired. That's condition of continued hiring is you have to pass NCLEX RN. I hope everybody passes who are planning to take it. But COVID-19 has it's a crazy time. People can't study in cafes, people can't study in libraries. People are generally confined to home, and some people just can't study at home. So a lot of people are failing NCLEX RN. I was talking to a RN resident, new RN resident, from cohort 11, and she was saying she graduated in 2020 from George Washington University's post baccalaureate nursing program, licensure art program. I think theirs is a bachelor's program, but it's shorter, 15 months. Um, she was saying that out of, I guess, 80 who graduated, um, people that she know of who took taken NCLEX RN have failed. Uh, yeah, two people have failed out of the ones she knows. I mean, I don't know if she knows all 80 personally, and people who fail may not tell you that they failed, right? So, but out of her immediate social circle, out of like people that she's close with, she knows two people who failed so far. Um, and so, every RN program is having people fail because you can't study in a cafe. Some people must study in a cafe. That's like their habit, right? They've always studied in a cafe in college, graduate school. And, some people always study in a library. They can't study at home. And a lot of people who live in the Washington, D.C. area have roommates, right? Because rent is so high, and it's hard to study at home with all these roommates. And young people are always socializing, COVID or no COVID, right? Especially if you're roommates. I mean, you may be like social distancing and trying to like be careful, but your roommate's not. They may bring friends in. And so, you know, it's hard to concentrate even when you're alone at home if you're not used to studying at home. So obviously, a lot of people are going to fail RN exams. So probably for the RN programs throughout this area, Innova Fairfax, Innova Alexandria, Mesa Georgetown. Mesa Georgetown's program was in July, but they may have hired some people who were, who had ATT authorization to test, but not have tested yet in July. Some of them may have failed NCLEX RN, and they may be terminated immediately. I think you have 90 days to take NCLEX RN exam after you have authorization to test. You get your authorization to test for NCLEX RN when you graduate from your program and receive a letter from your director of program that you completed the program, or send a final transcript. Obviously, final transcript comes out weeks after the last day of classes. So, you know, uh, so, but once you get your authorization to test, you could start working as an RN nurse with that authorization to test for like 90 days. It varies from state to state. But if you fail it when you take the NCLEX RN, then you're immediately terminated from the RN residency program. So those people who started our RN residency program at Georgetown MedStar Hospital in July, with authorization to test, they graduated in May. They probably sent the final transcript in, end of May, beginning of June. So they got their authorization to test probably by then. They have like until like September, if they got authorization to test a little bit later, because some um, nursing departments in the state are slower because of COVID-19. They're all working remotely. So Board of Nursing can be slow in their processing. In which case their authorization to test might have come out like beginning of July. And they could have started their RN residency program in mid-July at MedStar Georgetown Hospital. And then they have a July, August, September to take it, and they might have failed in September, and they're immediately terminated when they fail their NCLEX RN. So obviously, it's more difficult to pass NCLEX RN if you're working while preparing for NCLEX RN exam. And so people who are starting with authorization to test have, they're at more risk for failing than those who are just devoting full time to studying for NCLEX RN. I took my NCLEX RN on August 31st and passed. And I think it's like record time for Georgetown University for anyone to like take the test because our official graduation test date was like August 24th. So it's like 1 week after our official graduation date, I took the test and passed. But hopefully nobody has failed yet from my 25 clinical nurse leader cohort 2020. Obviously, if they fail, they probably won't tell people, or they may not even tell their closest friends. The group chat is going kind of silent. Hopefully, no one has failed. You know, um, and many haven't taken it yet. They're preparing like for 90 days to take it, or a couple months to take it. Like Billy is taking it today, and we technically graduate August 24th to September 24th. So he's taking about a month and a half to study for this exam. Some are going to take 2 months. Some are going to take a little longer than that to study for this exam because, you know, um, there are people failing NCLEX RN exam. People who've studied like weeks, some have failed. So that's happening all over the country. So there's probably a dip in the number of people who pass. And one disturbing thing that I heard was uh, it's it's bad, because we're going to have a lot of nurses die before Christmas, and then some recent graduates will fail our NCLEX RN exam. So that means we're going to have a lot of nurse shortages this year. So that's going to be bad going into flu season. But I hope everybody in my Virginia Hospital Center RN residency program who haven't taken NCLEX RN will pass. From what I understand, most have taken their NCLEX RN before starting their residency. Most of the people who started residency with me, took NCLEX RN, you know, uh, and had their RN license before even applying for jobs. So I guess that's how a lot of people do it. Like in my program, CNL 2020, there are people who haven't applied for NCLEX RN. I mean, they haven't applied for jobs yet because they haven't taken NCLEX RN. They want to make sure they pass before they apply. And that's why Amanda Patterson, our CNL administrator, emailed out saying Innova Fairfax is recruiting August graduates for their next RN residency. I'm sure they had some fail RN, NCLEX RN exams, so they probably lost several RN residents, new nurse residents, who probably started job before they took NCLEX RN, some have failed. And so they need to fill those slots too. So that's probably happening in many RN residency programs in this area, because it's hard not to have library to study at or cafe to study at when you're trying to take a serious exam, Um, but I hope everybody in my program who are planning to take NCLEX RN will pass. So good luck to you guys. High five on passing NCLEX RN. I'm sure Billy will pass. He's brilliant. So hopefully we get good news 48 hours from now that he passed. Yeah, let us know in group chat, Billy. You get like unofficial results after 48 hours, and then official results come back a little bit later. Like I think it's like a month later or so. Um, yeah. Um, yeah. So we have two important articles, and that is regarding America. And this is something that you need to pay close attention to. And my title today is COVID-19 USA, will over 3 million US citizens die by June 2021? The first article is Dr. Anthony Fauci predicts that a COVID-19 vaccine could be available by April 2021. And that's by Nicholas Rice on People magazine. Today, October 15, 2020. Significant quote from that is, during an interview with CBS Evening News on Wednesday, so that's yesterday, the 79-year-old director of National Institute for Allergy and Infectious Diseases, he could die from COVID if he gets it. He's kind of old. I didn't know he was that old. Revealed that a vaccine for the respiratory illness is likely on its way, and likely on its way, so he's not sure. And people will know by November or December if there is a safe and effective candidate. So what that means Translation, we may not have a vaccine in April 2020. Nobody seems to know, right? Nobody's willing to say that we're going to have a vaccine because there's a high probability we will not have a vaccine. Because as I've shared many times in my show, COVID-19 Update by Heerak, this is a daily show, so keep watching every day. COVID-19 is a very complex virus. It's not just a respiratory virus because it, by definition, it's not merely a respiratory virus because it infects a lot of different organs. It could cause stroke. Um, it's a complex virus. I mean, do you call AIDS respiratory virus or hepatitis C respiratory virus? So obviously they're calling it respiratory viruses because primary way it transmits is through breathing. But people have said that it can be transmitted by you touching a surface where people have coughed on and then putting your hand to your eye. So that's not going through respiratory, way. It's not transmitting just by respiratory, right? Transmission. Um, so a vaccine will likely be available within the first quarter of 2021 by, let's say, April of 2021. He told the outlet, but that would be predicated on the fact that all the vaccines that are in clinical trial have proven to be safe, right? Because 2 vaccines have proven to be unsafe. People are getting sick. And effective, meaning Dr. Fauci is doubting whether it's going to work, right? So if you're a betting person, I don't know if people are taking bets on this. I don't know if people took bets on October vaccine. If you bet against October vaccine, listen to your Christian kid, you won big money. I mean, obviously, I don't encourage gambling, but if you're a betting man and you're betting against April 2020 vaccine, you'll most likely win big money. Yeah. I mean, don't go betting though. I'm against like that kind of thing. Just gambling about everything. Oh, I bet I can run faster than you. Oh, I bet today it's gonna rain. Don't throw your money away. You need your money. You may lose your job. Because like a near million people have lost their job last week. Like near million people have lost their job the week before that. And now we have 6 months of COVID-19 is coming and everything's going to shut down. Millions of people are going to lose their jobs. You remember last year, March, last year, April? Yeah. It's going to be worse than that this year because it's in more areas. Second article, Fauci on coronavirus herd immunity. That is nonsense and very dangerous. It's an article by Crystal Hill in Yahoo News for today, October 15th. And the significant quote from that is, Dr. Anthony Fauci on Thursday denounced the concept of herd immunity, the notion that if a large enough group of people contract an infection, it will ultimately stop the disease from spreading, calling it nonsense during an interview with Yahoo News. Harry the Owl says it's a nonsense, because you know how many Europeans died from Black Death? 1/3 of the continent died. I mean, that's like if COVID-19, you're trying to go for herd immunity, in fact, there's many people, 1/3 of the world can die from COVID-19. That's like over 2 billion people can die from this in the next 10 years. Because we know we're not going to have a vaccine that's effective. There are all these strands, over 40 strands of COVID-19, and scientists have not even identified all of them and done research enough to say which strand does what. How are you going to develop a vaccine when you don't know what's going on with the different strains of COVID? I mean, you have to know these strains to develop a vaccine. We're going to be like stumble in the dark. And so, quote, anybody who knows anything about epidemiology will tell you that is nonsense and very dangerous, end of quote. Fauci said, quote, because what will happen is that if you do that, by the time you get to herd immunity, you have killed a lot of people that would have been avoidable. Yeah, 1/3 of the world can die. 1/3 of California can die. 1/3 of Texas can die. 1/3 of Florida can die. 1/3 of New York can die. So don't go for herd immunity. World Health Organization said COVID-19 is forever. CDC has said you can get reinfected with COVID-19. It's airborne transmission. You go for herd immunity, you're just going to kill off more people, right? I mean, geez. I mean, do you want to quicken your death? Like, it's like, fat people die earlier from COVID-19, right? And you get heart attack and coronary disease, right? So if you stuff yourself with bacon, as good as it is every morning, you're quickening your death, right? Um, you can quicken your death. Right now, Governor Northam, you see the photo on the bottom, and his beautiful wife, Pam Northam, has COVID-19. They could die from it. We don't know yet. They're not out of the safe zone. President Trump and his beautiful wife, the First Lady of the United States of America, they have COVID. Well, they're testing negative, they say, but it's in their system. So we don't know. It could resurface and they could die from it in the next 6 months of release. We don't know. Dr. Fauci, understands that this is airborne virus, right? It could spread like wildfire. Kamala Harris's 2 staff members have tested positive with COVID today. She may have COVID now. And if she has COVID, maybe Biden has COVID. We don't know. Next few days will tell us what the situation is with Kamala Harris and Joe Biden. Maybe you could ask Joe Biden tonight at his town hall whether he had contact with Kamala Harris or her 2 staffers who had COVID, because he may get COVID. He and his wife, Dr. Biden. And there's photo of Joe Biden being Tin Man and Kamala Harris being Kamazilla, yeah, underneath their photos. We may even not have an election by November 3rd if there's a spike that is so crazy and there are massive deaths. If both Kamala Harris and Joe Biden gets COVID, and if President Trump's COVID resurfaces, and if Vice President Pence gets COVID, we may not even have an election. So that's a possibility you should rule out. Obviously, I don't want anybody to get COVID, but it is a global virus. It spreads like a wildfire. Tune in every day. I'll keep you updated. This is the show to watch to keep up with COVID-19. I don't believe in the liberal media. Liberal media say you will have a vaccine by October. Where's the vaccine, CNN? Where's the vaccine, CBS? Where's the vaccine, NBC News? Where's the vaccine, ABC News? You can't trust these fake news. They tell you they'll have a vaccine and they lie to you. Where's that vaccine? Yeah. So watch this show every day, because I said there will not be a vaccine by October. I said that with 100% confidence. Just like I'm saying with 100% confidence, there will be no vaccine by April. They'll be safe and effective. Yes. So unfortunately, I wish there could be a vaccine, but the virus is too complex. I mean, we don't have an HIV vaccine. We don't have hepatitis C vaccine, and it's been around for like decades. Why do you think we're going to quickly come up with COVID-19 vaccine? It's like, do you think it's like abracadabra? Do you think this is magic? I mean, we're using science here. We're not in the dark ages. We're using science, people. The science says the chances of developing a COVID vaccine is very low. Very low. Yeah. Anyway, I'll keep you updated on all the developments. So watch this show tomorrow as well. See you tomorrow. Bye.